You might have experienced this. A doctor looks at the angiography report and says 90% blockage है. You will need a stent. Your world stops. घर में फैमिली में पैनिक शुरू हो जाता है. फोन पे रिलेटिव्स पहले से ही सर्जरी की डेट पूछते रहते हैं. डर, कंफ्यूजन, प्रेशर सब एक साथ. But here's what nobody told you, that 90% number, it's not the whole story. And in many cases, confirmed by two of the largest international heart studies ever conducted, a stent may not change your outcome in some cases. Ekdam such. Stay with me because what I'm telling you today could completely change how you think about this decision. First, let's understand what this number actually means. When a doctor says 90% blockage, they are describing what an angiography shows. Think of it as a live X-ray of your arteries. A special dye goes in and any narrowing becomes visible on screen. Visually, it looks terrifying. You are literally looking at your own artery barely open on a TV screen, and of course the instinct is to fix it. But here's what that image doesn't show you. It doesn't tell you whether that blockage is actively dangerous. It doesn't show whether your heart or your leg artery which is blocked is actually struggling. And it tells you nothing about whether this blockage developed over a period of time or suddenly. Because ये number 90% is just a shape, a photograph of a narrowing. It is not an absolute measure of risk. अब एक और चीज जो मैं आपको बताऊंगा जो शायद ही आपके डॉक्टर्स इतनी सिंपल लैंग्वेज में आपको समझाते हैं. योर बॉडी एक बहुत ही इंटेलिजेंट सिस्टम है. इट कैन एक्चुअली बिल्ड इट्स ओन बाईपास रूट्स अराउंड द ब्लॉकेज. स्मॉल ऑल्टरनेट ब्लड वेसल्स फॉर्म साइलेंटली ओवर मंथ्स एंड ईयर्स, एंड डॉक्टर्स कॉल दिस एज कोलैटरल सर्कुलेशन. That's when if a main artery is blocked, collaterals can develop around it. So a patient with 90% blockage but very strong collateral circulation, their blockages may not cause any other problem because the heart or the leg will actually perform better because of the collateral circulation. So the real question was never how narrow is the artery. The real question is whether that organ is actually suffering. अगर आपको heart में block है तो क्या heart suffer कर रहा है? अगर पैर की artery में block है तो क्या पैर की सर्कुलेशन सफर कर रही है? एंड दैट इज द क्वेश्चन यू मस्ट आस्क. एंड रिमेंबर वन थिंग, नॉट ऑल ब्लॉकेजेस आर बिल्ट द सेम. स्टेबल ब्लॉकेजेस हैव बीन फॉर्मिंग स्लोली ओवर years. They are dense, calcified and thick but walled off. The body has adapted to it. This is the dormant volcano sitting there quietly, not doing anything much. Unstable blockages are very different. They have soft inflammatory plaque underneath. They are more like a blister than a wall. The danger is not that they can slowly close the artery. The danger is they can suddenly rupture. And the moment they rupture, a clot forms instantly. The artery blocks completely, and that is when it leads to a heart attack, a stroke or a leg attack. And here's the part that genuinely surprises people. An unstable 50% blockage can be more dangerous than a stable 90% blockage. एक और बार सुनिए, 50% blockage can actually kill you faster than 90% because the risk is not in the percentage, it is in the nature of the blockage. और ये difference समझना ये सबसे जरूरी चीज है before you decide on treatment जरूरी है या नहीं. Now imagine two people, both have 90% blockage, same artery, same number on the report. One is directly taken to the cath lab for emergency angioplasty. The other goes home with medicines, with a plan, with follow-up. Both outcomes may be almost the same in time to come. And both decisions are medically backed. What makes them different? That's exactly what I want to show you next. And let me be very specific and direct about this. There are situations where a stent is absolutely necessary. Delaying it can cost someone their life. No discussion, no second opinion needed, just immediate action. Situation one, which most cardiologists would tell you, is when someone has an active heart attack. If someone is in the middle of a heart attack, chest pain hai, sweating hai, breathlessness hai, ECG changes hai, or even changes in the enzymes, troponin T if it is raised, then that blocked artery needs to be opened right away. Stent saves the life in this moment. There should be no debate. Situation 2 is when there is severe uncontrolled chest pain. If a person has frequent chest pain, even while sitting, even at rest or walking a few steps, and medicines are not helping, it means that the heart muscle is not getting enough blood. That is the heart crying for help. A stent provides genuine, meaningful relief here. And situation 3 is when ischemia is confirmed on testing. If a stress test, a nuclear scan, or a special angiography measurement called as the FFR or the fractional flow reserve confirms that a large portion of the heart muscle is being starved or deprived of blood, then that's a red flag for intervention. So in these three situations, a stent should always be done, and your cardiologist will advise for that. Have faith in your cardiologist and proceed with the stenting. But here's where it gets genuinely interesting, because in stable patients, patients without any of these three serious emergencies that I described, data tells a very different story. Two of the most important cardiology studies ever conducted are the COURAGE trial and the ISCHEMIA trial. And both these were not small experiments. Thousands of patients, more than 5,000 patients in one trial and more than 2,000 patients in the other trial, multiple countries, multiple doctors, and almost a decade of follow-up. Billions of dollars were invested in getting the answer right. And what they found was that for stable patients, stents did not reduce the risk of death. They did not prevent future heart attacks. They did not extend lifespan. Compared to this and aggressive medical therapy, the right medicines at the right doses combined with serious lifestyle changes were equally effective for these patients. So stents can relieve chest pain in stable patients. If you're suffering from frequent chest pain, a stent will provide you real comfort. But over time, both of the kind of patients, one who underwent stenting and the other who were very regular with the medicines and lifestyle changes, would probably do better over the next 5 to 10 years. So remember that heart disease is a systemic condition. It affects the entire vascular network. You fix one spot, but the underlying process will continue unless you make major lifestyle changes. Medicines और lifestyle सुन के ही लोग channel change कर देते हैं, क्योंकि सबको लगता है कि doctors इसके बारे में बोलते रहते. But I want you to know that this is the most powerful weapon against heart disease, more powerful than any stent, any surgery, any procedure. And here's what the research actually says with numbers. Whether you have a stent or not, the foundation is the same, and skipping it is where people go wrong. Medicines में blood thinners prevent dangerous clots. Statins, और ये आपको सुन के तकलीफ होगी, they don't just lower the cholesterol, they change the texture of the plaque, making it dense and stable, less likely to rupture. Statins के बारे में आपको जानना है तो we already have another video on it where I'll describing whether it's a scam or really useful. So have a look at that video if you feel the need to go into details of statins. Along with this blood pressure medications, they reduce the mechanical stress on the artery walls with every single heartbeat. And if you're diabetic, uncontrolled sugar is like sandpaper on the inside of your arteries. ये medicines एक protective wall की तरह काम करती. Coming to the role of exercise, a study published in the European Heart Journal found that patients with coronary or heart disease exercised regularly and consistently had better survival outcomes than those who received stents but didn't change their lifestyle. So you don't need the gym, but a 30-minute walk 5 days a week, इतना ही काफी है to get started. Exercise के बारे में we have enough of videos which you can start following. Coming to diet, diet also plays such an important role. You have to reduce your refined carbohydrates, maida hai, white rice in excess, packaged foods, reduce your fried foods and processed salts, add more vegetables and protein in your diet, add more healthy fats into your diet. These are excellent for omega-3s. Along with these, coming to sleep, poor sleep raises cortisol, and cortisol raises inflammation, and inflammation destabilizes plaque. This is not just vague wellness advice, this is actual physiology. Chronic stress, again, it may be office pressure, family tension, financial worry, literally all of these stressful conditions also inflame the inner lining of your arteries. Indians are particularly underdiagnosed for stress-related cardiac risk. So you have to learn to manage stress, meditation, prayers, time in nature, enjoy things which you do, pick up a hobby, do whatever works for you. Seriously, अगर ये सब इग्नोर किया तो स्टेंट के बाद भी ब्लॉकेज वापस आ सकती है. Every cardiologist knows this, but sometimes with consultation में ये सारी चीजें हर एक पेशेंट को समझना और समझाना मुश्किल होता है डॉक्टर्स के लिए भी. So if you, your father, your mother or your spouse is told that 90% blockage है, you need a stent, here's what you exactly need to do. Step 1, don't panic. Panic leads to rushed decisions. If it's not an emergency and in stable cases, you have the time, use it. Step 2, ask these specific questions. Does the person have symptoms? Are they severe? Are they being controlled with medicines? Have we done any other tests to identify the seriousness of this condition? And ask, is this situation urgent or is there time to explore all other options? Step 3, if it's not an emergency, you may seek a second opinion. There are many doctors, qualified doctors who accept the fact that patients have the right for a second opinion. But if it's a planned and a stable blockage that has been detected in an angiography, go ahead and ask your doctor. Step 4, commit to medicines and lifestyle. Whatever the decision is made, with or without the stent, commit fully. This is long-term management and not a one-time fix, and it is your responsibility and not the doctor's responsibility. Lifestyle, medications, and compliance with the advice is something which patients themselves are responsible for. And talking of stents, if you want to know how we as vascular surgeons open up blocked arteries, then do have a look at this video.